Putting GPs in control, that's how the government has sold its wholesale reforms of the NHS. Or to put it another way, family doctors will be given the bulk of the budget in England and will buy all the care for patients. But will they? Channel 4 News has been shown this document. It's about how services for patients are going to be commissioned or bought in the future. But GPs have reacted with absolute fury, saying that it is in effect a blueprint for the privatisation of the NHS. At the heart of the reforms, groups of GPs will be formed into consortia to decide what healthcare their local patients need. But this document lays out how these consortia can take on support services. And these, the government says, can be run by the private sector. This East London GP went so far as to say there would be little left for family doctors to do.
Very little actual commissioning is going to happen at the level of the CCG. The document says that GPs who are wanting to design services for their patients will have to get support from private companies. However, that support is so comprehensive as to include absolutely everything that commissioning involves. In other words, looking at the needs of their local population, choosing and designing the services that they need, managing the contracts, monitoring the quality. There's almost nothing left for us to do, and it even goes so far as saying that they can see a role for GPs perhaps in managing learning difficulties or other small local community services, but even then private companies will be doing the directing.
GPs we've spoken to highlight two parts of the document. This, which sets out what the support company would take over. It includes identifying best value providers, that is, deciding, for instance, which hospitals to send patients to. And this is the section that they say leaves them with just learning disability and community services. This comes a fortnight after ministers signed the company Circle to run Hinchingbrook Hospital in Cambridgeshire. And on that same day, the Prime Minister also said this.
From the Health Secretary, I don't just want to know about waiting times, I want to know how we drive the NHS to be a fantastic business for Britain.
And the GPs we spoke to say Circle is providing a service, while this document sets out for the first time how a private company will be purchasing care and ultimately, they claim, deciding what they do and do not want to buy. We've now learned that the British Medical Association is to discuss this document at its full council meeting on Thursday. But we also understand that members of the GP committee reacted with fury when they saw the details and demanded the BMA leadership take a stronger stand on the reforms. And so wide is the concern, it's also now to be discussed by the Royal College of GPs Council.
GPs are understandably concerned that the support they need may no longer be available from within the NHS because the government is insisting that the support should be provided by the private sector. But as long as that support is what GPs need, they have access to the right kind of expertise, it may actually be beneficial for the health service, providing the NHS can get value for money.
No ministers were available for interview, although a Department of Health spokesman tonight denied there were any plans to privatise the NHS. But the signs are doctors are preparing to step up their fight against the government's reforms of England's health service.